COVID-19 Antigen Rapid Test Kit, Colloidal Gold, Nasal Swab, Oral Pharyngeal Swab, Nasopharyngeal Swab, VTM. Check the lot number and expiration date prior to testing. Please read the instruction carefully before use and strictly execute the instruction. AmonMed COVID-19 Antigen Rapid Test Kit contains sample collection swab, extraction tube, extraction cap, extraction solution, test card, instruction for use, qualified certificate, materials required but not provided, personal protective equipment per local recommendations, for example gown, lab coat, face mask, face shield, eye goggles and gloves, timer, biohazard container, and micropipette. Test procedure for COVID-19 Antigen Rapid Test Kit. Open the package and take out the test card to balance to room temperature, 15 to 30 degrees prior to testing. Place the extraction tube on the workbench. Press the extraction solution bottle vertically downward to allow the extraction solution to drip freely into the extraction tube without touching the edge of the tube. Apply 6 drops, about 300 microliters of extraction solution, to the extraction tube. VTM. Apply 2 drops of extraction solution, about 100 microliter. Option 1. Sample collecting steps of nasal swab. Step 1. Insert the swab into one nostril of the patient. The swab tip should be inserted up to 2.5 centimeters, 1 inch from the edge of the nostril. Step 2. Roll the swab 5 times along the mucosa inside the nostril to ensure that both mucus and cells are collected. Step 3. Using the same swab, repeat this process for the other nostril to ensure that an adequate sample is collected from both nasal cavities. Withdraw the swab from the nasal cavity. Option 2. Sample collecting steps of oropharyngeal swab. Step 1. Let patient tilt head slightly, open the mouth, and make ah sounds. Expose the pharyngeal tonsils on both sides. Step 2. Hold the swab and wipe the pharyngeal tonsils on both sides of the patient with a little heart back and forth at least 3 times. Option 3. Sample collecting steps of nasopharyngeal swab. Step 1. Let the patient tilt head slightly. Insert the swab into one of the patient's nostrils until it reaches the posterior nasopharynx. Step 2. Slowly rotate the swab 5 times over the surface of the posterior nasopharynx. Slowly remove the swab from the nostril while rotating it. Insert the swab into the extraction tube with the extraction solution added in advance. Swirl the swab at least 5 times. Remove the swab while squeezing the sides of the tube to extract the liquid from the swab. Press the cap tightly onto the tube. Dispose swabs according to biohazard waste disposal method. Option 4. Operating steps of virus transport medium specimen. Using a micropipette to collect 300 microliter specimen from the collection cup or VTM. Mix the specimen with extraction solution. Press the cap tightly onto the extraction tube. Apply 2 drops, about 80 microliter of extracted specimen to the specimen well of the test card. Start the timer. Read the results at 15 minutes, and the results after 20 minutes are no longer valid. Positive result of testing, negative result of testing, invalid result of testing. Cooperating with Chinese Academy of Sciences. AmonMed has developed rapid diagnostic test kits for COVID-19 with a monthly productivity of 15 million units.